Hello everyone. Today we begin our exploration of an essential area within public health, and this is reproductive health. Reproductive health encompasses more than just avoiding illness. It is a holistic perspective on human well-being that influences population dynamics, gender relations, economic development, and community resilience. Throughout this lecture, we will unpack the significant components of RH, examine its global significance, and explore how reproductive health systems have evolved. By the end of today's session, you should be able to define reproductive health using a comprehensive public health lens, identify and describe key components of reproductive health and rights, explain how RH challenges develop across demographic, social, and economic contexts. Analyze the magnitude and consequences of RH problems globally and in low-income settings. These objectives will guide our discussion and help you connect RH to broader health system and development issues. Reproductive health refers to a state of complete physical, mental, and social well-being in all matters related to the reproductive system. It extends far beyond the absence of disease. It includes the ability to have a satisfying and safe sexual life, the capability to reproduce, the freedom to decide if, when, and how often to do so. Think of RH as a continuum across the life course, from puberty to older adulthood, with key needs arising at different stages. For example, a 15-year-old may need information about menstrual health, while a couple in their 30s may require access to infertility services. RH includes a broad set of services and protections, such as family planning, from modern contraceptives to fertility awareness, maternal and newborn health care, infertility prevention and treatment, comprehensive sexuality education, prevention and management of sexually transmitted infections, STIs, sexual health care, including care for sexual dysfunction, safe abortion care, and post-abortion services where legal. As you can see, reproductive health spans medical, behavioral, and social dimensions. Reproductive rights ensure that individuals can make decisions about their reproductive lives freely and safely. These rights include protection from harmful cultural practices, access to affordable RH services without discrimination, equal participation of men in reproductive and family life, bodily autonomy, meaning people can make decisions without coercion or violence. These principles shape modern public health practice and global agreements on sexual and reproductive health. SRHR matters for three big reasons. 1. Human rights. Every person has the right to health, dignity, and bodily autonomy. When countries protect these rights, individuals, especially women and adolescents, can lead safer, more empowered lives. 2. Health and social benefits. When communities have strong RH systems, children grow up healthier. Families plan and space births according to their needs. Women can pursue education and employment more consistently. For example, a district that reduces adolescent pregnancy typically sees improved school completion rates. 3. System-wide impacts. Investments in maternal and reproductive health strengthen primary health care, improve supply chains, and enhance emergency care systems for everyone, not just pregnant women. Gender equality and SRHR reinforce each other. Access to contraception, maternal health services, and sexuality education allows women and girls to make informed choices about their futures. Consider Rwanda's rapid increase in secondary school completion among girls. One contributing factor has been the expansion of access to adolescent SRH information and services, enabling girls to remain in school longer. Mechanisms linking SRHR to gender equality include autonomy in sexual decision-making. reduced child marriage, increased economic participation, more equitable household decision patterns. Gender equality is not achievable without safeguarding SRHR. Reproductive health plays a direct role in national development. Fertility transitions. Countries with declining fertility often experience a demographic dividend, a period when the working age population is proportionally larger than the dependent population. If accompanied by investments in health and education, this boosts economic productivity, disease burden, maternal deaths, cervical cancer, and HIV/AIDS contribute to significant disability-adjusted life years, days lost, which reduces national productivity. For instance, lost productivity due to preventable maternal complications can cost countries millions annually, resources that could otherwise be invested in education or infrastructure. SRHR, therefore, is a core economic strategy. Reproductive health may not be the first thing that comes to mind when discussing climate change, but the connections are powerful. Climate shocks increase vulnerability to gender-based violence, early marriage, and transactional sex. Women who have access to SRHR services, such as contraception and maternal care, are better able to adapt and recover after climate-related disasters. Communities with strong SRHR systems tend to rebound more quickly from environmental stressors. Strengthening SRHR is thus part of building climate-resilient societies. Stable societies depend on the well-being of families and communities. High maternal mortality, unmet family planning needs, and gender-based violence undermine social cohesion. For example, in conflict-affected regions, lack of contraception and skilled birth attendants increases maternal deaths and places additional burdens on already fragile health systems. SRHR contributes to peace and stability by supporting healthier families, more empowered women, reduced social vulnerability. Countries emerging from conflict often prioritize rebuilding RH services as a foundation for long-term recovery. Reproductive health and nutrition are deeply interconnected. Birth spacing improves maternal nutritional recovery and supports child survival. Adolescent pregnancy increases the risk of anemia and low birth weight babies. HIV and STI prevention supports better nutrient absorption and overall health. Access to nutrition education empowers families to make informed dietary decisions. A well-nourished population is a fundamental outcome and requirement of strong SRHR systems. Despite global progress, RH challenges remain substantial. Millions of women worldwide still lack access to safe childbirth services. Adolescents and young women face disproportionate risks of STIs and unintended pregnancy. Women in poor or remote areas experience higher maternal mortality, often due to delays in reaching care. Men also face RH challenges, such as untreated STIs and limited access to infertility services. But these issues often receive less attention. These challenges contribute to avoidable suffering and prevent countries from achieving development goals. RH systems have evolved significantly over the past decades. 1960s, 1970s. Rapid population growth triggered global interest in family planning programs. 1970s. Many countries expanded maternal and child health services. 1980s. International conferences highlighted women's health, infant survival, and the need for safe motherhood programs. Early 1990s. A shift began from narrow population control toward a broader rights-based approach. This historical pathway sets the stage for modern SRHR frameworks. During this period, three major themes shaped RH programs. Population concerns. Governments focused on addressing rapid population growth. Primary healthcare expansion. Maternal and child health services became central pillars. Emergence of rights-based thinking. Advocacy groups began highlighting women's autonomy and equality. These developments prepared the ground for the watershed moment we discuss next. The International Conference on Population and Development, ICPD, held in Cairo, revolutionized global thinking on reproductive health. What changed? The focus shifted from controlling population numbers to protecting reproductive rights and expanding choices. Women's movements emphasized autonomy and freedom from coercion. The HIV/AIDS epidemic pushed countries to improve STI prevention and education. The ICPD popularized key rights: the right to choose the number and spacing of children, the right to the highest attainable standard of sexual and reproductive health, freedom from violence, discrimination, and coercion. This rights-based framework continues to guide SRHR policy globally.